any specific questions that you'd like to raise. Obviously, this is a point of question time, isn't it? Your opportunity to raise any burning issues you've got with us. So, like this session to be interactive, please. The first update I wanted to provide was about the critical incident in our system. So you'll be aware from previous communications, our system has been placed in a critical incident for the last 3 weeks. Things do seem to be stabilising now in terms of the pressures on services as of the Easter weekend. So some shoots of hope that we might be coming to the end of that position, and we very much watch this space at the moment in terms of whether the incident can be stepped down over the coming days, but it does ebb and flow. Pressures of this nature do. So you'll know from our previous comms that we have been providing mutual aid support to staff in the terms of volunteer clinical staff, and we've been really been supportive of the pressures and staff. And thanks to our volunteers, which have agreed to transfer across there in the short term, we've had 22 staff working at SAF in recent days. So a big thank you to those staff for putting themselves forward to volunteer in the hour of need. And it's made a really big difference in supporting some of the pressures which staff have been experiencing on emergency care pathways. Our intention at the moment is that the mutual aid support will cease at the end of April, at the end of this month, and made that absolutely clear in all the system escalation meetings that our offer is time limited, and we're very much focused on the need to get our own internal activity, elective activity, back on track, because we have some very big waiting lists to focus on in the coming weeks and months, as you'll be well aware of. So that's the situation. We've currently been running for the past 2 or 3 weeks around 50 to 60% of our normal elective capacity. I think it's worthwhile to mention that we've been protecting all of our most critical service and longest waiting patients so that they're not compromised any further by the current situation. But appreciate it's been a really tricky time for everybody involved, and just wanted to say a really big thank you to those of you that have been caught up in all of the changes to plan and the flexibility that's been required to respond in the current situation. So yeah, as ever, a big thank you to everybody, whatever role you're in, for supporting the system's current position. So yeah, more news as and when if the incident has stepped down, but things have thankfully been easing in recent days. Right, okay, so Sarah, can I ask you to say a few words by way of update on infection control, please? And you might also want to mention the CQC position as well, and then we can open it out to questions.
Yeah, of course. Thanks, Craig. Hi, everyone. So just to keep you up to date, we've received on Thursday, just before the bank holiday weekend, the update for IPC for seasonal respiratory infections in health and care settings guidance. So we are working through that at the moment and what that means to us, but just some really high level stuff. Face masks to continue. There will be some changes to asymptomatic contacts in terms of patients. So we're just working through that at the moment. The lateral flow testing will replace PCR testing, and that's both pre-surgery and whilst they're in patients. But again, that we're working through that and implementing it in a safe and phased approach. And I think that's all that I wanted to share with you at the moment. In terms of social distancing, it's very woolly. It says pre-pandemic levels, but obviously we've got to do a local risk assessment for that, and it's got to be signed off by boards. So there's still lots of work to do. But yeah, I would appreciate your patience on that one. And then in terms of staff, so managing healthcare staff with symptoms of a respiratory infection, that updated guidance came a couple of weeks ago. So just the same messages: if you are COVID positive, please remain off work. You can return to work on day 6 following 2 negative lateral flow tests. Please continue to do your twice weekly lateral flow tests as well. and you can access them on the government website. And in terms of contacts now, if you're a contact of COVID from the community, you can do a lateral flow test rather than a PCR test, but we are still asking you to complete the risk assessment process as well. But happy to take any questions on any of that. And then, as Craig mentioned, the CQC, we've got an informal visit, so not an inspection, but their engagement meeting is going to happen on site next week, so next Tuesday. So please welcome them. We might come into your departments. There are only going to be 2 of them, and myself walking around the hospital. And then they're going to receive a presentation from our HDU team in terms of the improvements that they've made since the last inspection. And we'll ask them to talk to our senior nurses and doctors as well as part of the day. But again, happy to take any questions on that.
Thanks for that, Sarah. So yeah, that was, so we thought we'd keep it brief in terms of the agenda. Just those 3 issues really that we wanted to feed back today. Obviously it's a very live environment, but it's given you the very latest position that we've got on some of the most major issues that we've currently got as a trust. But yeah, this is the part of the meeting now that we open it up to any questions, or either on what you've heard or anything else that you would like to ask us. Now's your opportunity. Don't be shy.
I think there might be something in the chat.
Yeah, Chloe, do you want to help us with the chat?
Yeah, of course. So we've had a question from Sian Williams. So she's asking about hot desking. And she says, for those of us who have worked from home and successfully and safely for over 2 years, is there now an expectation that we come on site and use the hot desks, even with the high prevalence of COVID in the area and the associated risks of sharing an office with 15 people?
Yeah. I mean, just an initial response to that. We've introduced, or we're in the process of opening a new facility. So the former finance main office and the PMO office has been a contractor completely refurbishing that space for us in the over the past 4 to 6 weeks. And the purpose of that is that we work differently going forward as we come out of the pandemic. I think the pandemic has taught us an awful lot in terms of how to work most efficiently, how to work flexibly, particularly for non-patient facing staff. And working from home, despite its pitfalls, certainly has a place going forward. So as a trust, we recognise we want to take the best of both worlds going forward. So a hybrid working policy has been formed, and that enables all of our admin staff to have the opportunity to split their working week between a presence on site if they find that useful, and some time at home as well, using all of the technology, etc., that's been implemented during this period. So the hot desking policy itself, when that opens, there will be a booking facility which will be communicated in terms of anybody that wants to come and work on site. And it is encouraged to come on site at least part of the week, because it's the best opportunity of keeping in touch with colleagues. I think we do lose something from these virtual meets, albeit they are often more time efficient for people. Hence why the hybrid working does look to be the way for the future. But it's not mandatory, but we would expect it's in everybody's interest to to come onto site at least part of the week. Sarah, did you want to add to that?
Yeah, just from the risk point of view that was brought up, that's why we're asking people to continue to wear face masks at the moment. We do need to look through the guidance, but as long as your area is well ventilated and you're wearing face masks, the risk is fairly low for COVID transmission, and that the lateral flow testing that you do twice a week will be really important, particularly on the days that you attend site.
Any other questions?
I wasn't sure if you or Sarah wanted to talk about the IPC fair that's happening this week.
Thank you, Chloe. Yeah, really good one. Do you want to give that news, Sarah? I think it's been in the communications, isn't it? But an opportunity to plug that a bit further.
Yeah, and I can't take any credit for this. It's all Lisa's led a whole team of people bringing together lots of different stands. So some reps from external, some of our own staff, but looking at key IPC competencies, refreshing your knowledge, coming along and just having some fun whilst learning as well. So it's on all week until Friday. It's a drop-in, drop out. So Lisa's there taking names just to manage kind of numbers across the 2 rooms. It's up in the boardroom and one of the training rooms at the front of the hospital. So please come along if you can.
Yeah, no, good. I mean, it'd be really good for everybody to show their faces in that one. Actually, it's going to be a really good event, but really important as well. You know, given the spotlight the trust is under, as many staff can get across to that event as possible. It's to raise awareness and to have a bit of fun at the same time as well. So, would recommend people drop into that, please.
Sian's followed up in the chat just asking if they can order lateral flow tests, even if non-patient facing. One of their colleagues tried ordering some and it asked that question.
Yeah, if you work in a health and social care setting, yes, you're able to do so, whether you're in an administrative role or direct patient care.
And that seems to be it at the moment. So if anyone's got any questions, they can pop their hand up or pop them in the chat. Sarah Owen has asked about the new lead in safety training, if there's any more information.
I can take that one, Claire. So the patient safety syllabus has been launched and level 1 should be on your ESRs for everyone to complete, so clinical and non-clinical staff. So yeah, we're encouraging people to do that at the moment. We haven't had any more dates for kind of levels 3, 4 and 5 at the moment. Does that answer your question, Sarah?
Yes, it does. Thank you. So do admin staff have to do all the levels or just level 1?
Just level 1 at the moment. Level 2 is will be for our patient safety champions that were identified, and that could be a non-clinical member of staff as well as a clinical member of staff. So potentially, if you're a patient safety champion, you'll be asked to do level 2. And then, as I said, levels 3 to 5 haven't been released by RJAH yet.
And I presume this is mandatory training?
It is, yeah, that's correct.
Thank you.
Any last minute questions before we finish this session? No. Okay, well, on that note, we will end today's session, but thank you for your participation. Thank you for joining, and hope to see you all soon. Thank you.